Doctors and surgeons, what was your this just got even worse moment with your patients? Story 1. As a surgeon, I've seen some strange cases, but this one takes the cake. A guy came in with severe abdominal pain, and the x-ray showed a foreign object lodged in his intestines. He was reluctant to tell us how it got there, but we moved forward with the surgery to remove it. I thought it'd be a quick extraction, but as I started the procedure, I realized the object wasn't what I expected. It was a string of beads, and it just kept coming. Every time I thought I'd reached the end, there was another bead. I swear it felt like a magician's handkerchief trick, but with a much more horrifying twist. When I finally got them all out, I had about 3 feet of beads in my hand. The patient was fine afterward, but let's just say it wasn't the most dignified conversation when he woke up. Story 2. A patient came in for a fairly routine surgery, nothing too complicated. Everything was going smoothly until about 30 minutes into the procedure when the bleeding started getting a bit intense. It was way more than expected for this type of surgery. We managed to control it, but I was puzzled. After the operation, I asked the patient's wife if he had been taking any medications or supplements, just to double check. That's when she casually mentioned, "Oh yeah, he's been taking aspirin every day for years." Aspirin. The one thing that thins your blood and makes surgery a bleeding nightmare. Turns out, he forgot to mention that tiny detail during pre-op, and it nearly turned a simple surgery into a disaster. He was fine, but I definitely learned to ask twice about medications after that. Story 3. I was still a resident when this happened, and it was one of those days where the ER was absolute chaos. We were prepping a patient for surgery, and everything seemed to be in order. Just as we were about to begin, a nurse rushed in and said, "Wait, this isn't the right patient." My heart sank. We had almost started surgery on the wrong person. The patient we were about to operate on had the same last name as the one scheduled for surgery, and in the confusion, they'd been mixed up. It was one of those moments where everything could have gone horribly wrong, but luckily we caught it just in time. From that day on, I double, triple, even quadruple check patient names before starting anything. Story 4. One of the most bizarre moments in my career came when I was delivering a baby. The woman was scheduled for a C-section, and everything was going as planned. The baby was delivered without any issues, and as I was closing her up, I noticed something strange. There was another head. I paused, checked again, and sure enough, there was a second baby. No one had any idea she was carrying twins. The look on the parents' faces when I told them was priceless. The second baby was healthy and perfectly fine, but how they missed an entire twin on the ultrasounds, I'll never know. Talk about an unexpected plot twist. Story 5. I was treating an older gentleman for a serious heart condition. He'd been through the ringer with multiple surgeries and treatments, and things weren't looking good. His family had prepared for the worst, and I'll admit, I didn't have much hope. But somehow, against all odds, he pulled through. Months later, I received a handwritten letter from him, thanking me for giving him more time with his family. In the letter, he included a photo of himself at his granddaughter's wedding, a moment he never thought he'd see. It was one of those rare moments in medicine where things turn out better than you expect, and it reminded me why I do what I do. That letter is still tucked away in my desk drawer to this day. Story 6. Seen a lot of strange things in the ER, but this one takes the prize. A guy in his early 20s came in with severe abdominal pain. He was clearly embarrassed and wouldn't say what happened at first, but the x-rays didn't lie. A toothbrush was stuck in his intestines. When we finally got him to talk, he confessed that during a drunken dare, his friends convinced him to swallow a toothbrush, thinking it would be funny. But of course, it didn't go down the way they expected. We had to perform emergency surgery to get it out. The craziest part, when I was pulling the toothbrush out, it was almost entirely intact. I have no idea how it hadn't done more damage, but the guy was unbelievably lucky. He woke up afterward, and the first thing he said was, "Please tell me it's out." I handed him the toothbrush in a plastic bag, and he just groaned, "I'll never live this down." I'm pretty sure he won't. Story 7. It was supposed to be a routine allergic reaction case. A teenage girl came into the ER with swollen lips and difficulty breathing. We assumed it was a typical food allergy, so we asked her what she had eaten. "Jelly beans," she said. It seemed straightforward at first, until she told us that she had eaten them after knowing she was allergic to one of the dyes. I was shocked. Why would she knowingly eat something she was allergic to? Turns out it was a dare with her friends. They were trying to see how long she could last before having a reaction. Incredible. Her friends were in the waiting room, joking around like it was no big deal. and she even laughed about it at first while struggling to breathe. We had to stabilize her quickly, and it got serious when her throat started to close. I couldn't believe the recklessness, but she made a full recovery. She left the hospital later, waving at her friends, laughing like it was just another day. It still blows my mind how far people will go for a dare. Story 8. Had a patient come in for a severe skin infection on his back. When he removed his shirt, I saw a half-finished tattoo that covered almost his entire back. It was supposed to be some sort of elaborate design, but the ink job was terrible, and parts of the tattoo were literally peeling off. It looked like a DIY nightmare. He told me that his buddy had started the tattoo a week earlier, but halfway through, they ran out of ink. Instead of waiting to finish it properly, they used pen ink they found at home. Yes, pen ink. Now his skin was severely infected, and he had a high fever. It got worse when he mentioned that they'd sanitized the needle with a lighter because they couldn't find rubbing alcohol. We rushed him into treatment to control the infection, and he spent a few days in the hospital on antibiotics. The infection was so bad, he's going to need plastic surgery to fix the scarring. I'm still amazed at how casually he told the story, like it wasn't one of the worst decisions he could have made. Story 9. The weirdest day I've ever had. A guy came into the ER holding his hand to his stomach. He was in a lot of pain, and when we finally got him on the table, I couldn't believe what I saw. A screwdriver was lodged in his abdomen. When I asked him what happened, he said, "I tripped." That alone sounded insane, so I pressed for more details. Apparently, he had been doing some home repairs and left the screwdriver lying on the floor. While carrying a box of supplies, he tripped and fell directly onto it, impaling himself in the process. It sounded absurd, but sure enough, the X-ray showed the screwdriver cleanly stuck in his lower abdomen. Surgery went smoothly, and the guy was incredibly lucky it hadn't hit anything major. Afterward, he just laughed it off, saying, "Guess that's what I get for being too lazy to put my tools away." I couldn't help but laugh with him. But seriously, a screwdriver? Who would have thought? Story 10. A middle-aged man came in for what was supposed to be a routine surgery to remove a benign tumor from his liver. Everything started out fine and the surgery was going well, until we hit a vessel we didn't anticipate. Blood started pouring out faster than we could control. We immediately began transfusions, but the bleeding wouldn't stop. It was like trying to plug a dam with your fingers. The room got tense fast. I've been through tough surgeries before, but this one was different. No matter what we did, he kept bleeding. His blood pressure started dropping, and we were running out of options. Everyone in the room was focused, trying to stay calm, but we all knew we were losing him. It felt like time slowed down as we fought to keep him alive. In the end, despite our best efforts, we couldn't save him. I had to tell his family, and the weight of their grief hit me hard. It's moments like that when medicine feels both incredibly powerful and completely helpless at the same time. I've replayed that surgery in my mind so many times, wondering if we could have done something differently. That one, it stays with you. Still haunts me. Story 11. I have many stories. One is a healthy 23-year-old male comes into the ER with some chest pain. Normal vital signs, never smoker, normal chest X-ray. Pain started after eating something spicy. Tell him it's probably GERD. 5 minutes later, he drops dead in his bed. Start CPR and get a pulse back. Stabilized, gets CT scan and has an aortic dissection. Dies again in CT scan and never makes it to the OR. The guy's major blood vessel basically just exploded. This happens to men in their 70s with a long smoking history and high blood pressure. This healthy 23-year-old had absolutely zero risk factors for this. No evidence of Marfan's or Ehlers-Danlos for the med people reading this. Still makes no sense to me. Story 12. My father went to hospital with chest pains. They decided to do an angiogram. Dye injected, he's lying under the machine and the surgeon suddenly changes his procedure. "Are you okay? Feeling well? Any blackouts?" "No," he replied, "just pain." A few more docs come in and are looking at the screen. They take him to another type of X-ray machine and again are looking in bemusement without explaining anything. "You have a blood clot the size of a golf ball floating free in your heart. It's bouncing around the valves, and we would expect you to have died very quickly from this." So they gave him super strong clot busters, but were concerned it might shrink enough to get jammed. A lot of experts turned up. But all went well, and he had a triple bypass a few months later. That was 30 years ago. He's 87 now, and can walk with ease up steep hills. Story 13. A doctor here. You may have heard that diabetics need to have their eyes checked regularly, because diabetes is actually a blinding condition. This happened probably about 15 years ago. But this patient of mine I had noted had severe diabetic vascular changes against the retina and required laser intervention as soon as possible. Without getting into the socio-economic arguments here, she scheduled her surgery and on the day of the surgery decided to take a work date instead of her surgery. Her job was cleaning, and on that fateful day, she inhaled some of her cleaner fumes, which caused her to sneeze, spiking her blood pressure, and she blew the fragile blood vessels in both of her eyes wide open and blood started gushing into her eyes. As you might imagine, blood is opaque. You can't see through it. She was instantly and completely blinded in both eyes in a matter of seconds. It took 3 years, multiple surgeries, and a complete lifestyle change. But this patient did recover to have actually fair, but not good vision. I still see her now for her annual visits. Story 14. I'm not a doctor or surgeon, but I did work in healthcare, and this was in an urgent care setting. Should have been an ER visit though. I was assessing and taking information down for a 25-day-old newborn. The parents were very young and concerned that the baby wouldn't stop crying and never settled. I tried to calm them and reassure them we see this a lot. Baby seemed a bit feverish and red, so I took temp, and it was slightly elevated. You definitely don't want a newborn so young with a fever, but sometimes it's not very serious. I noticed one leg appeared possibly clubbed with the foot, but that was not what they were there for. The doctor returned after seeing them and said the baby was going to radiology right away. That's not good. X-rays come back and it's realized the one leg that appeared off to me was actually a broken femur. The doctor described it as, the only possible way for this to happen was someone had to have grabbed it and twisted hard. Suddenly, we are making a temporary cast to splint this tiny, not much bigger than a bratwurst-sized thigh, and loading the car seat on a stretcher for transport. Police arrive, and the grandma came crashing through the doors, screaming at these parents about how she's going to finish them for hurting her grandbaby. It was a little chaotic, but very depressing. It was long ago, but I still wonder about that one. Story 15. Was coding a patient in room 1. I bring the family in before I call the code if they want, so they get a chance to say goodbye before I stop. Wife was clearly gone, had probably died hours before. Husband comes in, sees her laying there, grabs his chest and down he goes. His was a ventricular arrhythmia, VT to BF, ultimately resuscitated. I saw him a year later for something unrelated, and he thanked me for saving his life, and told me he wished he hadn't lived because life without his wife wasn't worth living. Story 16. I was a junior surgeon working the night shift when a patient came in with severe abdominal pain. He was clutching his stomach and moaning in agony. The nurses rushed him in for an emergency scan, and what we found was shocking. His stomach had ruptured. The cause? He'd eaten almost 5 pounds of raw dough in a bizarre eating contest with his friends. The yeast in the dough had expanded in his stomach, essentially turning it into an internal bomb. We prepared him for emergency surgery. Everything seems under control at first, but as soon as I made the first incision, dough literally started oozing out of his abdomen. It wasn't just a small amount either. It was like his stomach had become a bakery, and the dough was rising faster than we could remove it. The smell was a weird mix of yeast and blood. The surgery went on for hours as we cleaned out his stomach and tried to repair the rupture. The weirdest part, the guy woke up after the surgery, groggy but aware, and said, "Did I win?" I still can't believe someone would risk their life over an eating contest, but hey, he survived and definitely learned a hard lesson about limits. Story 17. I was a young doctor fresh out of med school when a 50-year-old woman came in for a routine procedure. She had a history of high blood pressure, and we were closely monitoring her vitals during surgery. Everything was going smoothly until the nurse accidentally administered the wrong medication, a powerful blood thinner instead of her usual meds. Almost instantly, her blood pressure plummeted, and she started bleeding uncontrollably from the surgical side. Panic set in. We were rushing to counteract the medication, but the bleeding wouldn't stop. Her blood pressure kept dropping, and we had to give her multiple transfusions to keep her alive. The surgery room felt like a war zone, with everyone scrambling to save her. It was one of those moments where you think, this can't get any worse, but it does. After hours of fighting to stabilize her, we finally managed to stop the bleeding. She survived, but just barely. It was a close call, and I'll never forget how quickly things can go wrong when even the smallest mistake is made. The nurse was devastated, and while it was a human error, it was a lesson for all of us that precision in medicine is everything. Still gives me chills. Story 18. One of the most bizarre cases I've ever encountered was a man in his 40s who came in with severe back pain. He was acting strangely, constantly shifting and twitching, and he seemed a little disoriented. After running some initial tests, we discovered that he had a serious infection in his spinal column. The weirdest part, he had no idea how it got there. When we questioned him further, he revealed that he had been injecting alternative medicine treatments into his spine to cure his chronic pain. The treatments? Homemade concoctions of herbs, alcohol, and what he described as essential oils. It was a cocktail of bacteria waiting to happen. As if that weren't bad enough, when we opened him up for surgery, we found that the infection had spread to parts of his nervous system, and removing it was like trying to clean out cobwebs with a sledgehammer. The procedure took nearly 12 hours, and in the end, we had to remove part of his spinal cord. He survived, but he's going to live with permanent nerve damage. It was a painful reminder that sometimes patients can do more harm to themselves than we can fix. Story 19. This one is hard to forget. A man in his late 30s came into the ER with severe abdominal pain. He had multiple bandages wrapped around his stomach, and when we unwrapped them, what we saw was horrifying. He had tried to perform surgery on himself. Yes, you read that right, self-surgery. Apparently, he thought he had appendicitis but didn't trust doctors, so he decided to remove his appendix with a kitchen knife. The incisions were jagged and uneven, and he hadn't even come close to the appendix. He had sliced through muscle and fat, causing a serious infection. We rushed him into emergency surgery to repair the damage, but by then, his condition had worsened. The infection had spread to his bloodstream, causing sepsis. Despite our best efforts, he didn't make it. I'll never forget standing in that operating room thinking, how did it come to this? His fear of doctors had cost him his life, and I've never encountered a case like it since. It was a sobering reminder that sometimes the worst thing a patient can do is trust themselves more than they trust medical professionals. Story 20. Nurse here. Midwives let a mom go through over 8 hours of the pushing stage of birth to the point the mom went into severe decompensation. Blood pressure plummets, saturation drops, fetal distress, etc. In Canada, midwives practice separately from doctors and nurses. They usually just have an agreement with hospitals to use the beds, although medical care is available if the delivery becomes high risk. Doctors take over and go in for emergency C-section. Realize the arteries in the sides of the uterus are ruptured due to pulling away from the strained uterus and extensive pushing. Baby came out fine, but they had to work on mom. Finally closed her up only for mom's pressure to plummet again. They opened her back up and realized another artery was bleeding, so they clamped her aorta until they could repair the damage. At est, her lower body didn't receive blood flow for several minutes. They replaced her blood volume at least 3 times throughout. Finally, the team stabilized her but were afraid of anything else unexpected, so they packed her but left the wound open, then sent her to ICU. I received baby in the NICU. Baby was okay. Mom survived, although didn't find out much more.
That's a wrap for this video. Make sure to leave your relatable story down in the comments. I would love to make a video on them. Also, don't forget to like and subscribe. See you next time.